Good afternoon and welcome, ladies and gentlemen, to the House Health Subcommittee. It is Tuesday, March 7th, the year 2023, roughly 1:30 p.m. Ms. Adams, if you could please call the roll.
Representatives Hicks. Here. Jernigan. Yep. Leatherwood. Here. Martin. Here. Mitchell. Here. Sherrill. Here. Terry. Here. Williams. Here. Chairman Hawk.
I am here.
You have a quorum.
We detect a quorum. Members of the committee, do we have any personal orders? I see we've got a lot of friends with us in the audience. Any personal orders? Chairman Williams, you're recognized.
I couldn't help but embarrass my former leader who's standing at the back of the room. He was your leader too, Chairman Hawk. Leader and Jernigan, Leader McCormick, it's so good to see you again. Yeah, thanks for coming today.
Gerald McCormick, welcome. Glad to see you, Gerald. Always glad to have you here, sir. Any other personal orders? All right, we do have a calendar. We'll do a little, we're going to go straight to the calendar, beginning with item number 1. Item number 1 is House Bill 315. The request has been to roll this bill for 2 weeks. Without objection, the House Bill 315 rolled 2 weeks. We are now on item number 2 on our calendars, House Bill 1317. The request has been to roll this bill for 2 weeks without objection. All right. Item number 3 on our calendar is House Bill 966 by Chairman Hulsey. Chairman Hulsey, you are recognized.
Thank you, Mr. Chairman.
We have a motion. We have a second. You're recognized, sir.
Thank you, Mr. Chairman, and thank you, committee. I appreciate and always loved the joy and the thrill of presenting in front of Health Sub, I'll just tell you. Can I ask, just for clarification, do you have some folks to speak on this bill? And if so, is it all right if I make introductory remarks and cover some basics of the bill and then wait till they're through and before I finish my remarks?
Chairman Hulsey, we do have one individual who appears to have an opposition to your bill. We have one individual who appears to be in a neutral position on your bill. And that is all we've got on the speaker list at this time.
Okay, can both of those folks just cancel each other out and we'll be...
We'll wait and see.
Okay.
Chairman Hulsey, you're recognized.
In 1974, the federal government said to all the states, you're going to set up a certificate of need board if you want to keep receiving money due to pay on your health programs. And so every state did that. And the federal government had all these things designed that it should accomplish and help. By 1987, you saw one of the rarest things that the federal government ever did, and that is to look at something and say, gee whiz, this program isn't working, and it doesn't do what it's supposed to do, so let's end it. I think that happened in Prohibition, and it happened with Certificate of Need. And they did away with it in 1987, and when they did do that, 12 states immediately did away with the Certificate of Need. Tennessee didn't, and has still been doing Certificate of Need since then. And the best way I can relate it to you, if you're not familiar with it, is let's say I came to your town and I wanted to open up a hamburger place and call it Bud's Burgers. And I know a whole lot about hamburgers and I know how to fix them, and I actually have a better hamburger than most folks. So I come to your town and try to set up my hamburger place, and you come to me and say, you can't do that. You have to go in front of a burger board. We have a burger board here in this town, and you have to appear in front of the burger board to get permission to build your hamburger place. So I make plans to go in front of the burger board, and they say, no, you don't just step up in front of the burger board. There is a fee. You pay $3,000, and then there's a filing fee, and then you probably need a lawyer too to get in front of the burger board. And not only that, about 60% of the folks on the burger board have real good ties, and they actually own some stock in the other two hamburger places that we have in town, McDonald's and Burger King. And They really don't want any competition. And when you do appear in front of the burger board, the manager of McDonald's and the manager of Burger King will be there to tell why we don't want your hamburger and we don't need your hamburger in this town. Now, that's pretty much what you have with the Certificate of Need Board. Federal government set all this out. 1987 said this doesn't work. This paper is a pretty in-depth study from Middle Tennessee State University. It studied Certificate of Need issues, what they did, what they didn't do all across the country, and this paper relates specifically to Tennessee. So this bill doesn't wind down anything. It just ends Certificate of Need and gives people better health care at a cheaper price. And so that's what the bill does. I would like the chance to address after our guests have spoken.
Thank you, Chairman. Are you wanting to go forward with your amendment on the bill? We've got an amendment code 3551.
I do.
Okay. Chair will entertain a motion to place this amendment on the bill. We have a motion. We have a second. And I think, Chairman Hulsey, this creates an effective date, essentially an effective date of July 1, 2023, as opposed to the original bill that calls for upon passage of the legislation.
That is correct.
In a nutshell. Okay. Ladies and gentlemen, I'm fine to go ahead and put the amendment on the bill as we discussed. All those in favor of placing Amendment 3551 on the legislation, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill is now amended.
Thank you.
Thank you. We'll now go out of session, and we have Stephen Puckett. Is Mr. Puckett in the room? Hey, there's Mr. Puckett. Mr. Puckett, we are out of session, and as you know, we've got 3 minutes for you to share your thoughts on this piece of legislation. Sorry. Okay. All right, Mr. Puckett, you are recognized.
All right. Thank you, Mr. Chairman. My name is Stephen Puckett. I reside in Hendersonville, Tennessee. I speak to this legislation from my background, holding a Bachelor's of Science in Business Administration with a concentration in economics. I'm speaking in tentative opposition, which means that there is room for salvation for this legislation if it were to be amended to the recommendations and suggestions that I present to this committee. The challenge with certificates of need is that when we open up a market all the way, it, as has been shown in California, and especially with us having a victim from California, it can actually lead to what can be referred to as improper care. This isn't hamburgers. This is human life we're talking about and impact of people. And one of the challenges is that you've got to, with that, you have to strike a balance between not letting the market be too open, but also not letting it be too closed. And that's actually the problem here in Tennessee, is we overly tighten the market. And that's why the federal government recognized that over-constriction of the market is actually a problem. The difference is they put it back to the states to decide without incentive. My recommendation with this is actually to set a market minimum. That way, as Tennessee, we can go through our degrees. And that market minimum would be set at 3 equitable competitors, meaning 3 competitors of equal service provision. And that would and it would be set as an exemption for the competitors' override, their veto, as well as the need, because there is a critical need for a minimum amount of competition. Otherwise, you have intermittent monopolies and monopolistic behavior. The other thing is something I actually found out when I was looking at certificates of need, is that we also require it for charity care, which charity care by its nature does not focus on profitability, it focuses on care. And so the complete removal for charity care would be properly in order. So that would be my recommendation, as well as remove the charity care, because that would lift our the cost of indigent care on our hospitals, creating a more favorable environment. Thank you.
Thank you. Any questions or comments for the speaker? Seeing none, thank you very much, Mr. Puckett. I think Mr. Grant, Logan Grant, had put his name on the list to speak. I think his role would be to speak now, or would you rather speak if questions arise, Mr. Grant? Okay. As we're out of session, continue to be out of session. Mr. Grant, if you could tell us who you are, who you're with, and you've got 3 minutes starting now.
Thank you, Mr. Chairman.
Thank
Members
you.
of the Health Committee, my name is Logan Grant. I'm the Executive Director, and I report to the Burger Board and the Health Facilities Commission, as it's formally known. But I just wanted to let you all know that we are neutral on this legislation, but I did want to provide some context for your consideration of Certificate of Need reform, and that is that there have been ongoing Certificate of Need reform efforts since 2016. Of course, that was when Speaker Sexton passed the initial CON reform legislation. But in 2019, a working group of House and Senate members got together and said, hey, look, there's a lot of work to be done here, so let's do it in a deliberative fashion. And that resulted in the CON Reform Bill of 2021, which made tremendous reforms to the program. It reduced the size of the application by more than half, reduced the fees by more than half, and also reduced the amount of the length of time that it took to go through the process by more than half. And it was the beginning of setting up their vision for the ultimate elimination of CON. But before CON could simply be eliminated, there needed to be a process in place by which projects could be evaluated for their impact on consumers and for their quality. So that is what they've been working on in the past. Last year, legislation was passed to take the staff from the Board for Licensing Healthcare Facilities at the Department of Health, move it over to the Health Facilities Commission. This year, I believe next week, there will be legislation which will consolidate the licensing and the CON boards in 2024. And then over the summer, there will be ongoing conversations about the final legislation, which will kind of set the glide path for CON removal. So that's just the context I wanted to provide for the committee members. Thank you.
Thank you. Chairman Williams, you're recognized.
Thank you, Chairman. Thank you, Mr. Grant, for coming. I do think it's important to note, as Mr. Grant just testified, he was before House Finance yesterday for budget hearings, which we at great length talked about the revisions that have come down over the past three general session or general assemblies, and with the idea that in 26 that this even the funding would be revised based upon his testimony then and consistent with his testimony now. I have been a proponent, much like Speaker Sexton, for revisions to this, but just wanted to clarify, if based upon the current model of when we expect to phase out of CWN into this multi-year work, you testified yesterday in committee about a 2026 date. Could you tell me again what that is? That when the certificate of need would be fully phased out, or that's when it doesn't exist? Could you tell me a little bit more about that, please?
Yes, thank you. The plan that was presented to the General Assembly this past December had a couple would allow us for a couple years to implement new processes as would be defined or set out in the legislation that would be considered next year, and the elimination of CON and the adoption of a subsequent process focused on quality and consumer advantage would take effect on July 1 of 2026.
Okay. Thank you.
Mr. Grant, could you pull the microphone just a little closer to you there?
Yes, sir. Sorry.
Yeah. Questions or comments for Mr. Grant? Mr. Grant, I will go down the road that I went down yesterday with you in budget hearing as well. As we're looking to a revamp of the system, you mentioned the 2026 date when we were phasing out the CON process and going toward a licensure process. Are we looking to stack licensure on top of CON and just call it something else? Are we looking at CON 2.0? What vision can we gather from you as we move forward in the phase down process?
Thank you, sir. To answer your question simply, absolutely not. It is not just stacking them together. It is not reassembling the pieces in order to make them keep all the same components but have it look differently. there perhaps may be, ultimately it will be a decision of the CON working group who will have time to review the plan that I submitted to them over the course of the summer. So there may be components to that plan that they feel don't go far enough. However, I wanted to present them with options. Now, to the extent there are going to be components that may be similar to the CON program now, I would point out that those components are unique to Tennessee's and are a direct result of the reforms that have taken place over the past years. It will bear no resemblance whatsoever to the CON of 2015. So that is, I think that can be kind of a bit misleading if people are saying, well, it's just the same thing. Well, it will still have components that the General Assembly has found to be valuable, such as an evaluation of the quality of a proposed project, which of course is a good thing.
Thank you, Mr. Grant. Further questions or comments? Thank you very much. We may need to pull you back up, so don't go too far. Yes, sir. All right. All right, we are back in session. Chairman Hulsey, you are recognized on your bill.
Thank you, and thank you again, committee. This paper, put out by Middle Tennessee State, addresses some of the things you just heard. The modern aim, I'm going to read this executive summary. The modern aim of Certificate of Need laws is to decrease health care costs, improve health care quality, and increase access to health care by resisting health care expenditures. This paper reviews the evidence on the effectiveness of CON laws and finds that they overwhelmingly tend to fail to achieve their stated ends. And then it begins to break them down, and still a beginning coverage. It says, thus, CON laws provide a mechanism through which existing providers can artificially restrict the entry of competitors, allowing them to earn monopoly or cartel rents detrimental to healthcare consumers. In this case, rather than lowering costs and raising quality, CON restrictions on the supply of health care could raise the cost of health care and decrease quality by protecting inefficient incumbents from competition. They go then and break down each section that CON deals with and comes to a conclusion of it. The general empirical evidence on CON laws, they conclude there is no general evidence from the reviewed studies that suggest con laws have significantly reduced health care expenditures. Then their conclusion on restraining health care investments. There is no general evidence finding that con laws reduce health care investments. Then they dealt with ambulatory surgical centers. And their conclusion was these studies tend to find that con laws on ambulatory surgical centers do not produce the desired effect and decrease innovation and rural access to surgical care. They looked at the developing literature on the relationship between con regulation and health care issues for rural or poor residents suggest that con laws do not achieve this objective either. They looked at cardiac catheterization, and their conclusion was that catheterization for modestly improving the quality of weakly indicated cardiac catheterization, but found no improvement in quality for strongly indicated cases. They looked at emergency care centers. Their conclusion was there is no direct evidence in the literature, however, that con laws for emergency care actually reduce emergency care spending. They looked at home health care and concluded there are no studies that find comprehensive evidence in support of con laws in home health care. They looked at hospice care. Their conclusion was the primary finding is that these laws reduce the supply of hospice health care, decreasing access for patients in need of hospice care. One study in particular finds a need for expanded pediatric hospitals or hospice care. They looked at hospital beds and decided that restricting the quality of health care with little evidence of cost saving does not provide compelling evidence to maintain con laws. They looked at long-term acute care, and this was their conclusion. Con laws modestly decrease per capita spending on long-term acute care, but there is no evidence that removing con laws increases costs or affects the quality of health care or access to it. They looked at MRIs, and they concluded in this study it finds that con laws restrict the number of providers of MRIs by 20 to 33%, increasing the likelihood that residents will drive out of state to obtain needed scans. They looked at neonatal intensive care and decided that the single study finds that con laws reduce the number of NICU beds without affecting infant mortality rates. However, states with con laws and at least one major metropolitan area in Tennessee did see a slight increase in infant mortality. They looked at new hospitals. The two studies done in this area find that states with con laws are more likely to experience intensive care unit bed shortages and that con laws decrease rural access to health care. They looked at nursing homes and concluded in general the evidence finds that con laws are ineffective in controlling expenditures on nursing homes and long-term care beds, reduce access, and even reduce quality. The sole study finding evidence in favor of con laws on nursing homes is that they can reduce the expansion of the bed stock, taking into consideration other studies they do so without improving health care costs or quality. I'm almost through. They looked at open heart surgery, and they concluded the evidence of the effect of con laws on open heart surgery expenditures and quality is heavily mixed, suggesting that there is no definitive evidence to support the justification for con laws for open heart surgery. They looked at a PET scan, and they concluded con laws reduce the number of PET providers, but this increases the likelihood that residents will travel out of state to get the scan. They did the same thing with radiation therapy. They did the same thing with substance drug abuse, and they came to the same conclusion, that certificate of need laws do not do what everybody thought they would do. In fact, they cause problems. If you want to go into an interesting study, go look at what Americans for Prosperity put out on how much every county in this state lost through the process of con laws over its history. Millions and millions and millions of dollars. They say in this paper that you would have had 53 more hospitals in Tennessee and 27 more rural hospitals if we hadn't had con laws from the beginning. At the end of the day, the pay to play bothers me a great deal. There's a group up in my neck of the woods. I called about a week ago and said they recently have been in front of the Certificate of Need Board down here. And I said, how much it cost you? In this paper, it says the smallest amount is $3,000 to play. The maximum is $45,000 to play. This one organization that I talked to that recently appeared, by the time they paid the filing fee and the regular fee for the papers and hired their lawyer, nobody goes in front of the con board without a lawyer. They paid $245,000 just to get to appear in front of the Certificate Need Board. It's time to end it. People in Tennessee deserve better health care at a better price. And so that's the whole point of the bill, is it doesn't wind it down, it just ends it. And so that's what the focus of the bill is, and that's what I'm hoping.
Thank you, Chairman Hulsey. Chairman Jernigan, you're recognized.
Thank you. What year was your study? Just curious.
This was 2 years ago by Middle Tennessee State University. It's run by Dr. Daniel J. Smith and Macy Scheck, S-C-H-E-C-K.
Okay. Well, I'm not going to look them up, but let me ask you this. So in that study, did it say anything especially about ending a CON, just hard, clean, with no off-ramp, what the ramifications would be, or because obviously I think licensure should be in play before we end anything.
They actually did. I didn't want to tell you about it, but it was in the paper.
Okay.
It was not their best choice, so that's why I didn't bring it up. They did say that a process of licensure, if that's what you're going to do, is better than keeping certificate of need in place. It doesn't work as good as doing well with all of it, but the licensure part to replace and take it away is better than nothing. But their recommendation and the very summary in the end was the best move is just to abolish it.
Well, I think you would agree that, open up a free market, capitalism, that in regard to healthcare and what you're talking about, safety of patients, some standards need to be in place, and somebody has to. Reasonable standards when you're talking about healthcare is got to be somewhere. That I just can't have somebody who thinks they want to buy an MRI machine and feel like they want to run it, and I need some standards in place. And I think that if we just end it abruptly, I kind of like the off-ramp that we're taking. It's going to go away, I know, and God willing, you're alive to see it. But we're but it's gonna happen. Chairman, I love you, but that was just I just wanted to ask about that study, and I'm probably going to be more in favor of the off ramp than I was a sudden abrupt end to it. Thank you.
Thank you, and I will, for the record, say Chairman Hulsey is much younger than he looks. So
It's for poor health care is what my problem's been.
he's lived a very vibrant life, and I'll say that. Chairman Terry, you're recognized.
Thank you, Chairman. And just for the record, I just wanted to get this out there that generally I'm in support of phasing out the CON, but to use your language, I actually have privileges at 2 burger joints, and they're in a legal proceeding right now that even your time change on this would likely coincide with. So for the purpose of our vote, I will be abstaining.
Thank you, Chairman Terry. Any further questions or comments? I will state, Chairman Hulsey, you've done a tremendous job presenting the legislation. I cannot argue with anything that you've said. I think the debate is going to revolve around reform versus repeal. And as we move forward, I've got a caption bill out there that is waiting to get some reform language to it that's going to take us even further in the steps that you've mentioned. I do share, like the other gentlemen who've spoken, I do share concerns about the immediate nature of your piece of legislation as opposed to where we could reform over the next 3 years and as we are phasing out. So, ladies and gentlemen, are you ready to vote? All those in favor of sending House Bill 966 forward, please signify by saying aye. Aye. Any opposed, please say no. The noes have it. If you'd like to be recorded as an aye on the opposing side, please let Ms. Adams know if you'd like to be recorded as voting aye. The noes have it. Thank you very much, Chairman Hulsey. You did a great job. All right, we have had a request. One of our members has to make a trip to Memphis, out to West Tennessee. So, ladies and gentlemen, we are going to go out of order just a bit and go to item number 9 on our calendars. Leader Gant, you have House Bill 584. We have a motion. We have a second. Leader Gant, you are recognized on House Bill 584.
Thank you, Chairman and Committee. This piece of legislation is concerning my district, Selmer and McNairy County. McNairy Regional Hospital in Selmer closed on May 18th, 2016. Since that time, local residents have been in dire need of emergency and other care. There have been ongoing conversations with a variety of providers. In spite of numerous conversations, there has not been a provider that has committed to providing needed medical care to our constituents in McNairy County in this area. The only realistic provider that has expressed genuine interest in providing the care is Magnolia Regional Health Center, which is in Corinth, Mississippi, which is located 20 minutes away from the center of McNairy County in Selmer. And we want to provide care, but we have to have they want to provide care, but we have to have their medical staff to be able to be in the posture of being credentialed here in Tennessee. And there's currently a prohibition of the employees of out-of-state hospitals being credentialed in Tennessee. and this bill will provide an exception for McNairy County and allow the employees of Magnolia to provide critically needed care there in Selmer, which is in McNairy County.
Thank you, Leader Gant. Any questions? Chairman Williams, you're recognized.
Thank you, Leader Gant. Just wanted to follow up on a couple of quick questions. I will say I'm a little nervous about the prospects of doing this. Can you speak to me at all about how it would be limited only to this county, or is this open to, as you're well aware, we have the county in which you just described is a not a densely populated community like Memphis, Chattanooga, Bristol, Johnson City. So I have great concerns that if it weren't just to apply to your one individual institution, that it could be problematic, as we have multiple health professionals in multiple areas of medicine that would want to, or dentistry or whatever, want to travel over our state lines, because the large population of our community is around the perimeter of the state.
Leader Gant, you're recognized.
Yeah, thank you, Chairman Williams. In the communications with legal, more on the Senate side with Senator Wally, which is my lead sponsor over there, that would really, I would need to follow up with them over there on the exact conversations they've had with legal to kind of give you more pertinent, specific information in the language that would hold this legislation to what you just mentioned, McNairy County and Selmer. And I'll be glad to follow back up if we can kick this forward to the next committee. I'll be glad to bring you a more clear answer at that point.
Chairman
Unless
Williams.
legal wants to opine, on it.
Well, I think, and thank you, Leader. I of course, I have great respect for you, and anytime you ask for something, it's obviously extremely important to your community, and I recognize that and want to respect that. Typically, however, what it would say, if it were limited to a geographical area, it would reference either the licensure of that said entity or possibility a population variant or something of some nature in order to do that. And my fear would be if we did move it forward that, and of course, as you know, the House is the far more deliberative body as it relates to stuff, and there could have been a mistake on the Senate side. But I don't see any language in here that isolates it. But if we'd like to go to Councilor Miller out of session, she might be able to answer that question.
Leader Gant, without objection, we're going to go into recess to have that question asked of legal staff.
Okay.
So, Ms. Miller, if you could approach the microphone, we are out of session.
So currently, the way I see, I'm reading how it's drafted now, it's not limited to one specific county. And there are ways that can be done. I may have to ask for reinforcement on how that's done, but just currently how it's drafted is not limited to one county.
Questions of Ms. Miller?
So
Chairman Williams.
I recognize the glowing presence of Ms. Campbell is in the room now. So I thought maybe it might be the reason. I guess the question would be then is there has been a real angst, I guess, in sessions previous to do some kind of population bracket or something, which is why maybe the question would be, is there some kind of licensure if you were a Tennessee state license, but in this instance, there's not an entity that's licensed in the state. So I didn't know if there was something that could tie us to that county in this state.
Ms. Miller, do you have a response?
I can find out for you.
I think we may, the name of Ms. Campbell was invoked, maybe not. Give us just a moment there, Chairman Williams. All right, we're back at it. Chairman Williams, while we're still in recess.
Thank you. I had an opportunity to talk to Leader Gant. Maybe if we went back into section, I could make a motion that he and I discussed and give us an opportunity to kind of bye week here, if that's okay, and then he can get on to Memphis.
Without objection, we are back in session.
So I'd like to make a motion to roll this a week for Leader Gant. There is a method by which we think we can narrow it, but we just need a little bit more time to do that. It would not be a substantive delay to what he's needing to do, but it would also give us the ability to let him get out of here today.
The motion has been to roll House Bill 584 1 week. It has been seconded. Leader Gant?
Thank you, Chairman, and thank you, Chairman Williams, because we definitely don't want any unintended consequences to this to affect other parts of the state in a negative way. So thank you for your forethought on this.
Okay. Without objection, we will roll House Bill 584 1 week. Thank you very much.
Thank you, Chairman and committee.
Have safe travels. All right, ladies and gentlemen, we are back on our calendar as set. We are going to item number 4 on your calendars. Ladies and gentlemen, we are on item number 4, House Bill 1388 by Chairman Reagan. You have a motion and you have a second. You're recognized, sir.
Thank you, Mr. Chairman and committee. Board of Radiological Imaging and Radiation Therapy. Basically what it does is restores the X-ray operator board under the Board of Medical Examiners where it was prior to 2016. An original bill in 2016 moved them out. However, over the last 6 years, the board has been unable to finalize permanent rules or establish a license process and has done nothing to safeguard the health and safety of the welfare of Tennessee. The impact of this bill will be to get rid of what is obviously a redundant board and prevent rules from being put in place that would negatively impact hospital radiology. Since I sit on an entity in this body that reviews over 265 agencies and boards, I can tell you that from that perspective, this board really should be put out of its misery. If they can't do something in 6 years, keeping them around longer is not going to help. I stand ready to answer questions.
Thank you. Any questions or comments for the presenter? Seeing none, are you ready to vote? Forgive me. Chairman Reagan, in my haste, I jumped a little ahead of myself there. We do have an amendment on your legislation that I believe you were explaining.
Yes, sir. That was the amendment 4593.
Yes, ladies and gentlemen, Amendment Code 4593. You've heard the explanation for that. We have a motion. We have a second. All those in favor of placing Amendment Code 4593 on the bill, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. We are on House Bill 1388 as amended. We do have a couple of folks who would like to speak. We have Mr. Paul Searfoss. Is Mr. Paul Searfoss in the room? Okay. All right. We are out of session now. Dr. Searfoss, if you can please tell us who you are, who you're with, and your thoughts.
Yes,
you are recognized for 3 minutes.
Thank you, Mr. Chairman. Thank you, committee. My name is Paul Searfoss. I actually represent the Society of Nuclear Medicine and Molecular Imaging. As a certified nuclear medicine technologist, as well as certified CT technologist through ART, as well as the NMTCB, I'm here to potentially and tentatively basically, sorry, a little nervous, oppose this bill due to the fact that we want to ensure that we have safety for our patients. I'm not disagreeing on the potential of dissolving that committee. We do believe, because we did submit yesterday amendments to this bill, I believe the amendments were sent over by the Society of Nuclear Medicine, the ASRT, the NMTCB, as well as the SNMMI. We set these over there because we want to ensure that Tennesseans do have the safety that they deserve. We encourage to have state licensure for our radiology staff due to the fact that this is important to make sure we are providing the adequate care to our patients. When you think about the aspects of radiography licensures and requirements, there's only 4 states in the United States that don't have any type of setups, and Alabama being one of them. And I know as a proud Tennessean, we deserve better and we expect better for our citizens in the state of Tennessee. The aspects for patient safety come into play on that. You don't want someone that is uneducated or untrained or unlicensed performing radiology imaging on patients in those aspects. So the proposals for us, they would still dissolve the board. We would want these amendments to ensure that we are maintaining professional credentials and standards for our radiology imaging in that aspect. When I go through these things, it is important to make sure that we follow these through because we have these education standards set in place. When we follow through with Joint Commission and things like that, it's important that we understand these aspects because the whole reason we're in healthcare is for our patients, and we want to make sure that the patients deserve those kind of that kind of care that we provide for them. And that's all I have. Thank you guys so much.
Thank you, Doctor. Questions or comments? Chairman Jernigan, you're recognized.
Thanks.
Forgive me, Doctor. We do have some questions
Yes, sir.
For you there.
Yeah,
Thank you for
All
standing
right,
up.
no problem.
I just have one question, and thank you for your testimony. Chairman Reagan, I guess, has made some maybe accusations that there's some trouble with the organization with this board in the past. Do you think that there's trouble with the organization of the board, or
So
there's
I don't
struggles?
sit on that board. I'm not in disagreement on the aspect of the 6 years requiring. My biggest proponent is to ensure that we have state licensure for our radiology personnel. The whole goal behind that board, from what I gathered from 6 years ago, was to create state licensure for it. They have state licensure for x-ray techs that prior to this board would fall under the Board of Medical Examiners. And the whole proposal is to have the same kind of requirements branched out to cross modalities. So when you look at CT or nuclear medicine or PET or MRI, those kind of things, MRI is one of the most dangerous places in a hospital. So if you don't have someone licensed in it or truly credentialed in it, you are really putting patients at risk in those kind of things. Now, with that board on their ability, I haven't been on that board. I, wasn't privy to the board until probably about 3 years ago when I started being the tag representative for the SNMMI. And so, our whole goal is to ensure that we are focused on making sure we have state licensure for these other credentialed modalities to make sure we're providing the best care for our patients, whether it rolls up to the Board of Medical Examiners versus the other board.
Chairman Jernigan.
So you really don't care one way or the other where the board goes away as long as you're statutorily protected somewhere in the law?
Yes, so our focus is to make sure we have protection for our field as well as for our patients, because if we have state licensure, if I was state licensed through the state of Tennessee, you look at other states like Florida and California, they do have state licensure. The benefit of it is if I get terminated from a job because I did a misadministration or something like that, in reality, it's just an honor system set up right now, and I can go get another job right down the road at another hospital and potentially put another patient at risk by having the state licensure rolling up to whether it's a Board of Medical Examiners or that other board. It protects our citizens because then the board is overseeing it and making sure that, this person was terminated, and we can kind of move forward and prevent it from happening to another patient.
Chairman Williams, you're recognized.
Thank you. Thank you for your testimony today. Just a quick question. So I had got a contact from somebody from my district about this bill. So if this bill will go through as it currently is, what would differentiate you from my gutter guy?
So, well, technically, so you look at it, Right now, if you dissolve it, you could have your gutter guy performing your radiology imaging, and that's a lot of harm that's potentially posed to our Tennesseans. When you think about those kind of aspects, there's no education requirements to have a limited X-ray license in the state of Tennessee, and you're following those kind of guidelines. And when you're putting patients at risk, when you think about it in those kind of aspects, because with my degree in nuclear medicine, I could sit there and administer a therapeutic therapy to a patient, and then if I'm not licensed or uneducated, I could kill a patient. MRI, you could actually kill a patient quickly if they're touching the sides of the bore of the magnet. Those are things that we want to make sure we're preparing and preventing this type of harm for our patients.
Chairman Williams.
Thank you. I don't know if somebody from a stakeholder on the other side is listed to testify on this bill or not. It just seems to be some inconsistency one way. Not a reflection on anybody, but the more we communicate about this, the further lost I get. And so it'd be nice to hear from.
Chairman Williams, we do have a couple of supporters, if requested, that we can go to. I will ask a question.
Yes, sir.
Why, and you've mentioned 3 years involvement, why have we not accomplished what we intended in 2017?
I think there's been a lot of oppositions because the state licensure that was originally proposed had so many restrictions. So when you think about the rural hospitals, there was restrictions because you do have technologists that are, whether they're limited technologists or not, they're performing MRIs and CT on patients that they're not certified in. And some of the objections that kept coming into play were the rural areas because they don't have the ability to get them licensed or certified in those fields. When you think about it, they do have programs out there that actually give people the opportunity to get certified in those, and they get all the credentials and things that are needed, whether it's the didactic or the clinical checkoffs that are needed. So there are courses available. It's just a matter of, do you want to go and do it?
Thank you very much. Thank you, Dr. Suroff.
Thank
Sir
you.
Foss. Cindy Gilbert. If Cindy Gilbert is on the list to testify on this piece of legislation. Ms. Gilbert, if you could please tell us who you are, your interest in the bill, your potential qualifications, and tell us what you'd like us to know. You have 3 minutes. You're recognized.
Thank you. Thank you for your attention. My name's Cindy Gilbert. I moved to this state 2 years ago. I have a Master's of Health Administration. I used to manage in the other state where I came from, and I'm a registered nuclear medicine technologist, as well as positron emission technologist. So that's a mouthful. I understand that there is a little bit of inconsistency with the bill, the old one and the amendment, and hopefully I can help clear that up. But I did write something out, and I'd just like for you to hear it before I get there. In this state, you have to have a license to hunt, to fish, to cut hair, to do a manicure. With the amendment that you have in front of you, that takes away nuclear medicine technology, which can perform your studies for your cardiac stress tests, which will look to see if you have cancer. You can administer radioactive materials. You're giving therapy. You will also exclude radiation therapists, who are the ones that will use the radiation therapy to cure cancer of your loved ones. So the amendment that we have, I actually don't know which one of the amendments that you have, but from what Paul had said, all of the societies that you had heard about, we got together and we came to a consensus, which was hopefully sent to you yesterday, which is what's presented in front of you. So the amendment that I am speaking to, which I hope you have, is one that will regulate X-ray technologists, which is what the original amendment was, including nuclear medicine and positron emission tomography, and the radiation therapy. Because otherwise you'll have your X-ray technologists being able to do radiation X-ray studies, but anybody who looks good in a white lab coat will be able to perform your nuclear medicine studies as well as your radiation therapy. So if when your terms end, if you need a job, I have a white lab coat and can get you a job somewhere in a hospital so you can inject radioactive materials tomorrow. So our ask is that the board considers this and we'll go with the second, whatever amendment that you may have that states we wish, because we all agree the board can be moved. You can dissolve the licensure board. We're not in opposition of that. You can put us under the board of medical examiners, that's fine. And we need to be regulated. We need to have minimal education, and we have to have board certification, which all the other states not all other states have that, but we need to have this for safety for our patients. I can tell you that the state that I came from, I was told, this was before we had state licensure, I was told, Cindy, here's an ultrasound tech. I want you to teach him how to do cardiac stress tests. I don't know if any of you have had that. You get injected radioactive materials, they scan your heart, they look at it top to bottom, see if you have a blockage. 1 week. So he went away, we trained him for 1 week. 3 weeks later, he calls me up, hey, Cindy, I just injected I-131 into a patient's arm. I-131 is designed to kill thyroid cancer in your body. And patients can swallow it by capsule or by liquid. He drew it up in a syringe and injected it in a patient's arm. And it just ate the arm. He didn't know what he was doing. This is what could happen. I saw it firsthand. This could happen.
Ms. Gilbert, I've let you go a little longer than I should have
I'm
there,
sorry.
but your time's up.
That was fast.
I think and we'll get back to the sponsor of the legislation, but I think we're headed the direction that you've mentioned. Any questions or comments for Ms. Gilbert as we're out of session? Okay, seeing none, thank you very much, Ms. Gilbert. We'll bring up now Zach Blair, Mr. Blair from the Tennessee Hospital Association. Mr. Blair, if you could tell us who you are, who you're with, and what you'd like us to know. You're recognized. 3 minutes.
Thank you, Mr. Chairman. Zach Blair, Tennessee Hospital Association. Want to apologize for any confusion related to this bill. I think the way it was originally drafted may have made it look like there was an elimination of certification for these professionals statewide, and that is not the case. This bill simply transfers the regulatory authority for these professionals back to the Board of Medical Examiners as it did before 2016. As Chairman Reagan alluded to, the board that we are discussing right now has been in existence since 2017. They originally proposed rules in May that would have negatively affected over 1,000 professionals in Tennessee. I also had the opportunity to review testimony and presentations for this bill when it was passed in 2016. At that time, several members asked, are there any identified safety concerns with this profession that would lead to the need to create a board and additional regulation? At that point, the answer was no. I asked the Department of Health yesterday if they had any safety-related issues with these professionals, and the answer is no at this time as well. We believe certification, patient safety is critical in this area. Certification for those practicing outside of a hospital setting will continue to remain in the CMS and Joint Commission accreditation standards that are very, very intense for these professionals in hospital settings will continue, because if the credentialing, the education, and the certification is not proper, then that puts accreditation and status with Centers for Medicaid and Medicare Services in jeopardy. So I want to get back to the heart of the bill. The net effect of this bill is nothing, because licensure regulations have not been promulgated. The Board of Medical Examiners still has their existing valid rules to be able to regulate this profession. It is simply putting the statute back to where it was prior to the bill and the board being created.
Thank you for the clarity. Chairman Williams, recognized.
Thank you, Zach. I appreciate that. So just one quick question. Prior to the 6 years from when this board was originally formed, was it a certificate that they had prior to that, and that after this change of this, it will still be a certificate? There was no different kind of licensure. It was simply a certificate.
Chairman. The creation of the board contemplated a shift to full licensure, which is not consistent with what we do in surrounding states. In fact, 4 of our 8 surrounding states have no certification or licensing requirements whatsoever. We are just returning to a state certification process that we technically currently still have.
Okay.
And that has not identified any patient safety issues in the history between that time and where we are now talking about this particular piece of legislation.
I knew we could find some clarity. Thank you, Chairman.
You're welcome. Any more questions? Chairman Jernigan, you're recognized.
Thank you, Zach. What do you have to do to be to get certification? To get a certificate, I guess.
So you have to have a credential from one of the nationally recognized organizations. A few of them were mentioned, and unfortunately, my acronym memorization of those is not great right now. But you have to have that certification, and then you get certified through the Board of Medical Examiners to put those practices in place in those clinical settings that are required.
So as what Chairman Williams mentioned earlier, you wouldn't be able to hire a gutter guy?
Absolutely not.
Okay. Or otherwise, you'd be the CMS authorizations you would lose, and liability and all that, right?
Completely. Yes, sir.
So if we get rid of the board, standards aren't going away?
No, sir.
Okay. Thank you.
Thank you. Any further questions or comments while we're out of session? Thank you, Mr. Blair.
Thank you, Chairman.
Thank you. We are back in session. Chairman Reagan, we are back on your bill, House Bill 1388. Any questions or comments for the sponsor? Question has been called. All those in favor of sending House Bill 1388 to full Health Committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Mr. Chairman and Committee.
Thank you, Chairman. We are now on item number 5 on our calendar, House Bill 155, by the very patient Chairman Hicks, the other younger Chairman Hicks.
Thank you.
You are recognized, sir. Do we have a motion? We have a motion. Your papa seconded your motion, so
Thank you. I appreciate that.
you're recognized.
Well, after that last bill, you are going to love this simple bill right here. So, House Bill 155 is simple in what it does, but it is very impactful for what it will do to EMTs across our state. This simply provides an $800 training supplement for licensed emergency medical personnel who are employed full-time for an ambulance service upon completion of 40 hours of annual training. And I stand ready to answer any questions.
Thank you, Mr. Chairman. And I believe Representative Sherrill has a personal order to discuss folks here in support of your legislation. You recognize Representative Sherrill.
Thank you, Chairman, and thank you, Representative Hicks, for bringing the bill today. And just a few minutes to recognize we have a number of men and women with us today that represents either EMS or the Rescue Squad. And we just want to make you very much welcome. Appreciate y'all, what you'll do for us in the great state of Tennessee. If you would, make them welcome.
Please stand up. We want to see you. Please stand up. Thank y'all for your service.
Thank you.
All right, any questions? Chairman Williams, you're recognized.
Thank you. What an excellent bill this is. Very delighted to support it. I just was a little bit concerned about the fiscal note and didn't know how you thought that might go.
I know a guy. All I'll say is I do look forward to working with that committee to try to get this completely over the finish line.
Chairman Hicks, I'm trying to remember if you have ever put yourself behind the budget before, and I think I actually have heard you put yourself behind the budget before.
I don't enjoy it, but I have.
Well, it just makes you feel like the rest of us there,
right.
sir. All right, any questions or comments for the sponsor?
No.
Ready to vote?
Yep.
We are ready to vote on House Bill 155 to go forward to full Health Committee. Please signify by saying aye.
Aye.
Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Chairman and Committee.
Thank you. Item number 6 on our calendars, ladies and gentlemen, is House Bill 913 by Chair Lady Littleton. It has been taken off notice. Without objection, House Bill 913 off notice. We are going forward. Item number 7 on our calendars. I saw Chairman Faison was in the room earlier. Has he left? Okay. We've been informed that Chairman Faison may be eating one of Chairman Hulsey's hamburgers. So he is, we're going to roll him 2 spots. Well, that may not work. Tell you what, we're gonna roll him. We'll roll him to the heel at this moment without objection. Item number 8 on our calendars, House Bill 370. The request has been to roll House Bill 370 by Chairman Clemens for 2 weeks. Without objection, House Bill 370 is rolled 2 weeks. We have already disposed of House Bill, item number 9, House Bill 584. We are now on lucky number 10. Item number 10 on our calendars is House Bill 653 by Representative Fritz. You are, do we have a motion? We have a motion. We have a second. You're recognized on House Bill 653.
Thank you, Mr. Chairman and committee. I want to present House Bill 653 to you and ask for your consideration. There is a drafting code for an amendment 5024.
Thank you. I think we'll go ahead and place the amendment on the legislation as we discuss. We have a motion. We have a second on amendment drafting code 5024, as the sponsor said. All those in favor of placing the amendment on the legislation, please signify by saying aye. Any opposed, please say no. The amendment is on your bill. Please describe your bill now as amended.
Thank you, Mr. Speaker, or Mr. Chairman. This amendment changes the bill to the original, bill due to concerns and responses raised by several folks who we worked with to satisfy those. The Tennessee Department of Mental Health and Substance Abuse, the Department of Aging and Disability, Tennessee Facilities Commission, Health Facilities Commission, Hospital Association, and Healthcare Association. And before I describe exactly what the bill does, I'd like to start with just a brief story, and I'll be respectful of y'all's time. Dear friend of mine for a long time, and I could put several names to this same story that I would not be so privileged to call friend, but Charles and Cheryl Laxton. Mr. Laxton retired as a state trooper. Had intended to spend his retired years with his dear wife there in Roane County. Fell ill, went into the hospital, and due to the restrictions that were on the facility at that time, he was one of those many people that were unable to be comforted by his loved one over that time in the hospital. Again, I could give you numbers, dozens of persons that have shared that same story. I'll share one other with you. A dear lady I sat in Calhoun's with about a year ago in Lenore City, and she grabbed my hand and tears ran down her face. And she said, I was married to him for 57 years, and I just wanted to hold his hand one more time, and I wasn't allowed to. And he passed without her seeing him. So this bill is intended to address this. This bill adds additional exceptions by which facilities can prohibit visitation by a family member or a member of the clergy. As you read through this bill, committee, I would ask you to notice that what it simply does is protects the rights of that patient to be visited in a hospital and the rights of that family member to visit that patient. We have numerous studies that indicate that that familial care is tremendously important to the healing process. Further, it protects the rights of that clergy or church-affiliated person to visit with this patient at one of the harder times in their lives. That is a tremendously important thing as persons go through significant health issues, whether they are required to be in a hospital or a nursing home. It protects the rights of the families to stay engaged. Again, we do have multiple studies that show that there's a great health improvement on the patient when this takes place. In an article in the American Medical Association Journal of Ethics in 2016, it stated hospitals where patient family care-centered care, PFCC, is a part of the organizational structure, culture The culture finds that not only that the patient, family, and staff satisfaction ratings are significantly increased, but also that the patient's health outcomes are improved. Implementation of PFCC is also correlated with a decrease in patients' emergency department visits, faster recovery, and a decreased utilization of healthcare resources. Yet despite many of these facts, facilities were forced by federal and state mandates to keep families away during the pandemic. My heart weeps for those people, as I know many of y'all's does as well. Tennessee did address this in 2021 during a special session by passing legislation to allow family members to see their dying loved ones, and that is important, and I thank you for that. The problem is we don't always know when we're about to pass. So this bill simply addresses that. And so with that, I'll ask for your support of this bill and stand ready to answer any questions, Mr. Chairman.
Thank you. Chairman Williams, you're recognized.
Thank you. Thank you for the bill. Obviously, this is very important to you. You had an opportunity to talk to one of your constituents. I have a little bit of a concern. Of course, my grandmother was in a long-term care facility for many years, and there are many examples of which I could think of, but I guess the one that comes to mind would be a protective order, an abusive child or parent, someone who did not have that person's best interest at heart, or someone who, quite frankly, had Alzheimer's, like my grandmother did. Sometimes the visit from the family was harder than not having one.
Yes.
And just wondered what your thoughts were. Would that keep somebody, would any of those provisions keep those, either an abusive family member or some other person who cared more about their own specific interests than they did about the patient's interests? How do you justify the two, if you could help me?
Representative Fritz.
Thank you, Mr. Chairman, and thank you for that question. It is a great one. So we did, with the guidance from several organizations in the bill, address some of those specific things that you mentioned. We mentioned that there's an exception to prohibit visitation to a prohibit visitation in accordance with the wishes of the power of attorney. That's important sometimes in the later phases of life. Prohibit visitation in accordance with a court order is specifically called out in this bill, so that we don't have those who have other interests in mind forcing a visitation on someone who is in a hospital or a healthcare facility. And then you'll see some specific exceptions in this in working with our mental health professionals to allow the therapeutic care of the patient at that time to be protected by perhaps in some cases keeping the person in treatment rather than disturbing that therapeutic care with a visit, because as you've mentioned, sometimes that can be detrimental.
Mm-hmm.
So we did try to address those.
Mm-hmm.
Chairman Williams.
Just a follow-up question. Obviously, you referenced earlier in your comments that you worked, that you appreciated what we did as related to the special session for COVID. I guess what the weird thing is what would this bill do that one didn't do? I guess maybe that's where I'm lost. If current statute already what is applicable, and we just removed the sunset from all that, what would your bill do that's different?
Representative Fritz.
Thank you, Chairman. Thank you for that question. Again, what it simply does is the bill then was for dying patients. And so it is difficult to forecast the date of death. This bill would protect patients who perhaps aren't imminently facing death, but for a long hospital stay, or perhaps in a nursing home or care facility. I had the sometimes painful but often bittersweet experience with my dear mother as she faced back in 2017 dementia and Alzheimer's. And I know that sometimes that could be a disruptive thing, as you mentioned, but it was also one of those times, often one of those times when I would walk into her room when just seeing my face, even though she had gone nonverbal at that point in time, that there was something uplifting in her presence just to see her favorite son. And so this protects through all of life, not just end of life. Just directly address your question.
Chairman Williams. Were you going to ask if he has any brothers? Was that going to be the question?
No.
Okay.
I would say the interesting part is a lot of the challenge for me is being able from a grandson, parent, son myself, whose right is it? Is it the patient's right to see visitors, or is it the visitor's right to see the patient? And where is that best vested? To me, I'm more of this is a patient's right to have visitors, and if they say, that Ryan Williams doofus, he didn't buy me a good Christmas gift last year, and they don't want me to see them, then they have the right to not let me see them. I guess.
Thank you, Mr. Chairman, and thank you again for that great point. Something I started to mention I should have. This bill also prohibits visitation to a mentally competent patient who's refused to accept visitors. So it certainly honors that patient right first.
Chairman Terry, you're recognized.
Thank you. Appreciate you bringing this, and I understand these concerns, and obviously with COVID when it came through, actually some of the language you have in here was some of the stuff that I had worked on previously, but in a previous, what we have current statute on COVID, it says a hospital shall implement written policies and procedures regarding the patient's right to receive visitation during a period, when COVID, so that basically they can put restrictions on that, and you have 6 things where they can place restrictions, one being, or place restrictions or limitations on the frequency and duration of visitation areas that of the facility that necessitate a higher level of safety protocols or sterile environment. That was meant for ICU and for the operating room. But through this, I don't see a limit on the number of people that could potentially be in a room. I don't see a time limit. So you might have a patient next door that's recovering from surgery and they need rest. And the patient next to them now could have, all comers at all hours of night. And that from taking care of patient standpoint, that could impact them. And that's one of my concerns, that this doesn't have these type of protective guardrails on there. And I understand from a liberty perspective, we always look at, our liberty and the patient's liberty and the liberty of those. But what about the other, we don't want to infringe on theirs. And that's my concern, how this is written right now. Thank you.
Any comments, Representative Fritz?
Thank you, Mr. Chairman, and thank you for the comments. I too share those sentiments, that the rights of that person in the bed in those dual occupancy rooms is important as well. And it was not the intent of this bill to abrogate the rights of that person.
Representative Mitchell, you're recognized.
Yeah, thank you, Mr. Chairman. Where's the THA or the THCA on this bill?
They have not asked to speak on the legislation.
Yeah, but do you know, do they support your legislation?
Representative Fritz.
Thank you, Mr. Chairman. I think so. I don't want to try to put words in their mouth, but we did draft this with input from many different groups to try to capture all the comments we possibly can.
Are you sure they support your bill?
Well, I said I think so.
Mr. Chairman, could we hear from THA or THCA?
We cannot.
I think but Mr. Chairman, I think we have the sponsor of the legislation is saying that a group supports this bill, and I think it's imperative we back up that support.
Representative Mitchell, I think we're going to let this play out,
Okay.
and we'll see how the conversation goes. So, Representative Fritz.
Thank you, Mr. Chairman. Thanks, sir, for that question. I certainly am not trying to mislead these groups as to what their opinions are on this. We did work with lots of groups to try to craft this so that we got all their comments into it.
Okay. All right. Any further questions, comments? I will, and Representative Fritz, thank you so much. I recall specifically an instance where during the COVID time, a patient had gone into the VA hospital, Veterans Affairs Hospital in Northeast Tennessee, and a frantic wife called me and said they won't let me see my husband, and I'm the only one that can calm him down, and he's not going to be a good patient. And a simple phone call to the ombudsman created an effort where they could supersede or give an exception to this family, and there are exceptions that I have found to just about any rule that we can ultimately, if the desire is there, we can get family members to see family members. Unfortunately, I'm experiencing this very thing right now, although my father broke a hip 2.5 weeks ago, and in the hospital room setting, and now is in a long-term care setting, and is having struggles. And at that point in time, when he was admitted to the hospital, he was asked, and of his full faculties and my mother and family were asked, who should we put on the list to come visit? And we gave a list of everybody and said, well, you let us know if we need to add anybody to that list. And the hospital has been very good to work with us on that and to ensure that our pastor and anyone who wants to come within reason, as was explained by Chairman Terry, can and would see those individuals. I am fearful that this legislation, and as much as we do not like the federal government, there are some federal rules and guidelines that funding to the hospitals is contingent upon following some federal laws, and much of that funding is federal by nature. And there could potentially be some conflict between this new section of code and federal code. So I do express my personal concerns on the legislation as we move forward. Representative Fritz, you're recognized.
Thank you, Mr. Chairman. I appreciate that. Most of the people, as you all I'm sure are aware, that I spoke with about this matter that is so near and dear to their heart were aged folks. But I did have a prominent member of one of our communities, young lady in her early 40s, and she told me these words. She spent 28 days in the hospital. She needs corrective lenses, as many of us did. Didn't have those, and she spent 28 days in the hospital. She told me, she said, Monty, I lost all will to live. My husband was not allowed, at that time he was the chief deputy in that area. He was not allowed to visit me. And she said, I didn't know that I had anybody around because I couldn't see. She said, the only thing that kept me from just wanting to die, 28 days, was the thought of her 1-year-old granddaughter. And so I certainly understand the concern about butting heads a little bit with the federal government. I would just submit to you folks that when it comes to these type passionate rights, perhaps it is the right thing for us as Tennesseans to stand up and assert ourselves as free men and women against those type things. And with that, I'll stop and again ask you for your support. Thank you.
Thank you very much. Are you ready to vote? All those in favor of, forgive me, I'm lost. All those in favor of passage of House Bill 653, please signify by saying aye. Any opposed, please say no. No. The noes have it.
Thank you, Mr. Chairman. Thank you, committee.
Thank you very much, Representative Fritz. You did a very good job.
Thank you all.
Thank you. We are about to run out of time, ladies and gentlemen, but we are going to go out of order. We had rolled Chairman Faison to the heel, and even though sometimes we think he is a heel, we are going to, I'll be here all week. We will recognize Chairman Faison on House Bill 981. Do we have a motion? We have a motion. We have a second. You're recognized, sir.
Thank you, Mr. Chair. Committee, very good to be with y'all. We do have an amendment that writes the bill, drafting code 4780.
You have heard the amendment, drafting code 4780. We have a motion. We have a second. All those in favor of placing amendment drafting code 4780 on the bill, please signify by saying aye. Any opposed, please say no. The ayes have it. We are on your bill as amended, sir.
Thank you, Mr. Chair.
If you wish to be recorded as a no, please let the staff know. Thank you. You're recognized.
Committee. Several years ago, I was put on Government Operations Committee, served on that committee for 4 years. In that time, I learned an enormous amount about state government. There's a couple hundred boards and commissions in our state that operate, promulgate rules, do all sorts of things for the people of Tennessee. The majority of those boards are appointed by the governor and the Speaker of the House, Lieutenant Governor. There were times in my tenure in GovOps that we felt like boards were not doing the job that they should be doing, and we would work with them.
Sometimes they would not work with the legislature, and then we would literally just vacate the board and start over. That is what this bill is doing. It's with the EMS board. Last year, the EMS board got sideways with the Senate, and they put them in something called wind down. It takes the House and the Senate to be able to keep a board or a commission going. They put them in wind down. That put the EMS board working with people all across the state, trying to keep this board going back up so it doesn't cease to exist. We need an EMS board. And so they have partnered with the Tennessee Ambulance Service Association, the Tennessee Fire Chief Association, Professional Firefighters Association, the Tennessee Hospital Association, Medical Association, Tennessee County Service Association, the Nurse Association, Association of Rescue Squads, the EMS Educators Association, and the Tennessee Chapter of American College of Emergency Physicians. All of those groups have worked together. It's not possible to get everybody in Tennessee excited about rebuilding the board, but all of these people have come together and said, we agree with this. And that's what this is doing, is allowing the board to be reconstituted. And all these people I just mentioned are good with it.
You've heard the explanation. Chairman Williams, you're recognized.
Thank you. Mr. Chairman, I'm willing to jump right in if we want to. We've got 3 minutes left to the committee ends, and I have to be in another committee. The chairman did a great job describing the process. I would disagree with the process. As the chairman knows, the sunset provisions, as he did over there, this was a problem which was created in the Senate by a senator who no longer resides there. It's my understanding that there were discussions in the short term as it relates to that. There are many questions that I have regarding this particular bill and the sunset of it and the how as to why it was done. I really think that it was done in such a way that brings dishonor to people who sat on that committee and served this community for more than a decade on the sunset on the EMS board. I do think it's something that we shouldn't take lightly, nor should we try to hurry through with a question soon. So I would ask the chairman, instead of making a motion as it relates to an adjournment, I would ask, because of the late hour of the day, if we could take this bill up at the next committee in which it's in front of us.
The chairman will entertain that suggestion by Chairman Williams that we roll this bill 1 week in order to have some questions and allow the Chairman Williams to further discuss this with Chairman Faison. Without objection, we'll roll House Bill 981 1 week. Ladies and gentlemen, as we are running out of time, I'm going to go through the calendar of what is remaining to potentially dispose. Are we on item number 11? Item number 11, House Bill 827 by Representative Sparks. We are rolling 2 weeks without objection. Item number 12 on our calendar, House Bill 305 by Representative Jones, is taken off notice. All right, ladies and gentlemen, because we have run out of time, it is 3 o'clock. All the remaining bills will be moved to next week's calendar without objection. Ladies and gentlemen, without objection, we are adjourned. Thank you very much. You're welcome.